Good afternoon. It's Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Friday, February 26, 2021, and I hope this will be our last COVID-19 update. I'm coming this morning or this afternoon. It's been a crazy day at the health system, and we've been doing vaccines, and I'm going to talk about it, but it's just been a fascinating day, and I left my badge on because I ran over from doing the vaccines, but it's just been an amazing day here at the health system as we're a couple things going on. One, the numbers. Today is our lowest day of COVID patients in the hospital that we've had in months. Not just 1 month, not just 2 months, but last year, it's easy to say. Right now, we're sitting with 9 patients with COVID in the hospital. We have 2 going home in the next 30 to 45 minutes. So we'll be at 7 patients with COVID in the hospital. Now, I say that with a little worrisome. That doesn't mean we should all run out and have big, giant, not social distance parties, and we need to be careful of what we do. We need to continue to do what we're doing. But when we talk about hope and we talk about those numbers going down, we still have 5 in the ICU, or 4 in the ICU and 5 on the floor right now. So we still have 4 people with COVID who are real sick. So it's real. I don't want to create a false sense of security for anyone in this community. None of my friends, none of my family members. I want to make sure everybody understands the seriousness of the crisis and the disease. But everything as a health system, everything our physicians have done, everything our clinical team has done, everything you as a community, our leaders, our judges, the fire chief, the police chief, our sheriff, everybody in this community, what's done is moving us in the right direction for new norms. So I want to say on behalf of myself, my board of managers, and the executive team, thank you for all those individuals for everything they've done to move us in the direction, and for an opportunity I can sit here and tell you we're at our lowest number at months, and it's a good thing. So from a numbers down, I'm not going to show graphs, even though the CPA wants me to do. I'm not going to show graphs. I'm not going to get into pie graphs and chart graphs. I'm just going to say it's great to sit here and see that number go down. But I encourage you, please take it serious. Please wear your mask. I had the privilege of talking to one of our community members a few minutes ago, and she told me, she said, I'll be so glad to get rid of this mask. And I told her, just because we're getting the vaccine doesn't mean the masks are going away. And I don't envision a world in the hospital that the mask won't be a part of it, because there's some advantages from a standpoint that are helping us today and will help us going forward. So again, just want to thank you, the community, for everything you've done as we continue to fight this crisis and mitigate the spread in our community. From a vaccine perspective, you know, it was emotional today at the hospital. We've given over 800 vaccines, or real close to it when I came over here, real close to 800 vaccines today in our clinic across this morning. And it's been a great thing. About half of those were second dose. So all of our week 6 people who were worried about they've been coming in today and getting their second dose. And then about half have been first dose. And those are the ones we've received this week. And we've gone down our waiting list of trying to get people in to get them. So it's been exciting to listen to the people come through. The people in this community have been so grateful. And we've got so many great comments. And many of the people who come through today listen to this Facebook post or this Facebook Live and are so grateful for everything. But I appreciate you listening. I appreciate you telling your friends and your family about the things that are going on in this health system. I do believe you're spreading this information, and we're helping this community together. I'm going to get some chats and get some posts about we're waiting for the calls. We still have a long list. And when I say 400 new first dose, and we have 8,000 people on our waiting list, that's the hard part. And I had a man this morning talk to me about it and says, why can't you get more? We're trying. And I believe we're doing everything we can from a health system. We're talking to everybody in Austin, our legislatures, to try and get more. Every time there's an opportunity to get more, we jump at it and we take it and we get it. So I ask you to be patient. I ask you to keep looking for other resources as well. I don't want you to have to go every place, but if you get an opportunity to get the vaccine, you jump at it. And then stay on the list and just keep following up and keep dropping us texts like this and emails. And we're going to get everybody in the community vaccinated. That's our mission, and it's where we're trying to go. So again, thank you. But it's been a great day in the hospital. I do want to thank Michelle Shoemate and her team. Michelle's been phenomenal in leading the vaccine coordination. Her and Kiara have been working together and representing the health system of getting everything planned. And I will tell you, they've got it down to a machine, and people are coming in less than 22 minutes. They're getting them in, getting them out. And I hope the state of Texas watches this video. I believe we're doing it as good as it can be done. And we've got people coming in and getting their vaccine and getting out, and would like more, and have challenged the state to give me 2,000 a week. And we'll do this every Friday. We'll do this till we get Northeast Texas vaccinated. So again, thank you for your support. Please keep going to our wait list. Put your name in, make sure it's on there, get your friends on there. And again, as we get more vaccines, we'll continue to get them out there. And I see Charlotte on there. Thanks, Charlotte, for the thank y'all. I appreciate it. Last night, as we wrap up COVID, and COVID is going to be a part of our life, and it's not going to go away. We're going to make changes in the health system to fight COVID consistently going forward. The hospital itself will never be the same. We're going to restructure. We're going to continue to do things to keep you safe and to fight infectious disease in the hospital. And our health system today is ready to keep you safe when you come to the hospital. And we'll continue to do things. We had the privilege last night. I had the privilege of being the moderator of a town hall cardiovascular impact with COVID last night with our 3 cardiologists, and it was fun. I always enjoy talking to these 3 physicians, Dr. Abbas, Dr. Sekulich, and Dr. Siegel. Joined me last night. If you get a chance, I encourage you to go to Titus Regional Medical Center's Facebook and look for our share from their website of the Heart and Vascular Institute at Titus, and look for that share. They spent some time last night talking to us about the impact of COVID and cardiovascular disease. February is Cardiovascular Month and Heart Month. And we were privileged. I will tell you, we're blessed. And I said at the end last night, I'll say it again. We are blessed to have those 3 men in our community and in our hospital. And those 3 men, along with the rest of our doctors here at Titus, are the foundation for some of the best care in the United States. Not rural hospital, not Texas, but in the United States. And to our doctors, and especially these 3 for last night, for joining us and giving up their spare time just to talk about COVID and cardiovascular disease, I appreciate them, and I appreciate you. We talked about earlier, and we planned on it. We planned on possibly this being our last, what we call COVID update, and hopefully we don't have to have them anymore. It's only fitting that we're going to end up with 7 people by the end of this presentation this afternoon in the hospital. So we are going to move to a community update. We're going to change the dates a little bit, trying to find the best day available so we can keep you updated. The one thing we've done over the last year is kept an open communication between the community of Northeast Texas and our health system, and we want to continue to do that. We're going to look for ways to make sure you know what's going on, and look for ways for us to find out what are the needs of the community that we could do better. We're going to get together each Thursday at 2:30, and we'll have our community update. So we're going to move to that day. I'm excited about it next week, so please join us. I've had a couple people this morning who said they enjoy seeing me 3 times a week. Well, I enjoy being here 3 times a week. But the good news is we'll go weekly, and we'll talk about what's going on, and we'll still talk about COVID. COVID's not going away. We realize that. I know you realize that, and I appreciate that as well. So again, on the behalf of everybody at Titus, just want to thank everybody. Please be patient on the vaccines. I know it's frustrating. I know it's frustrating, and I'm so sorry that we can't do more, but we are trying. And I appreciate everybody who had the chance to come out today, who did come out and bring their friends out or bring their family for their appointments. And we'll continue to get those appointments. We will get a few hundred on Monday, and we'll set them up in the clinics next week to get them scheduled as well. Continue to go to the wait list, and again, we'll continue to make it our mission to vaccinate this community and work with the state and the federal government to try and get more. Thank you for your support of our health system. Thank you for support of our community. God bless.